Our cancer genetics program allows patients to see cancer genetics experts that can help break down their hereditary risk for cancers.
Our cancer genetics program has two different pieces. On the risk assessment side of our practice, we're able to provide genetic counseling, potentially genetic testing for patients to understand what their lifetime cancer risks may be. Another part of our program is the Genetic Cancer Prevention Clinic, or GCPC. That is for patients where we've identified a known genetic mutation that we know causes cancer risk or cancer predisposition.
Genetic counselors really are care providers that look at your personal medical history, look at your family medical history, and determine if you may be at risk for a genetic condition.
Together, we evaluate their cancer risk and develop a plan to screen them for cancer.
The best scenario is that the genetic diagnosis is made in such that any cancer that may develop is caught in a very, very early stage such that the treatment is minimal.
People can be referred in through a care provider. We also take self-referrals.
Within an NCI-accredited cancer center, we're able to offer them opportunities to potentially enroll in clinical trials, to get involved in research.
We are a center of excellence for both the VHL Alliance and also the P10 Alliance.
And we help long-term with care coordination and referrals to specialists, and we can also help refer them to providers who can help with risk-reducing interventions if they are interested.
There was a history of cancer in my family, so I decided to receive genetic testing, and I tested positive for Lee-Fraumeni syndrome. Basically, my body does not recognize cancer and stop it. Being faced with that, it was very difficult, it was daunting, and for a few years, I put off dealing with it. When I found this clinic, that was the first time I was able to take a deep breath and say, I'm okay.
What I love about this program is our multidisciplinary approach. We are the only one in the state of Texas who has all of these components under one roof.
We have a conference prior to seeing a patient in the clinic where we review all of the information. That way we really help streamline the visit and provide the most value for our patients when we see them.
Patients can come for one visit and see a genetic counselor, a provider, and a nurse navigator.
We can help coordinate and guide them through the process. We also offer them the amazing support services from UT Southwestern.
We're really fortunate to have dietitians, social workers, chaplains, and music therapy. One of the most interesting aspects that we've been able to deliver is mental health support.
I do a lot of screenings, but the biggest decision that I made was receiving the prophylactic mastectomy. And I was comfortable in that decision because of my care team here.
To see Anaya thriving, we were able to intervene for her at a time before she had breast cancer. And to know that that is one little part of stress that we've removed from her life is pretty great.
This is really a before, during, and after continuum. There is no better place in Texas to undergo cancer care.
Family history does not have to be the future. That is of such critical importance to the ongoing health, not only of families, but of populations we serve.
It is scary and daunting when you are diagnosed with a genetic syndrome and you hear the word cancer. The power of knowing and what that means for your future is so important. The choice is yours, but you want to do it at a place that understands, a place that wants to be at the forefront of research and knowing these things, and that's what you find here.